ACL injury. An ACL injury is a tear or sprain of the front cruciate tendon, ACL, one of the solid groups of tissue that assist with interfacing your thigh bone, femur, to your shin bone, tibia. ACL wounds most regularly happen during sports that include abrupt stops or course adjustments, hopping and landing, like soccer, ball, football and downhill skiing. Numerous individuals hear a pop or feel a popping sensation in the knee when an ACL injury happens. Your knee may grow, feel unsteady and become too agonizing to even think about bearing weight. Contingent upon the seriousness of your ACL injury, treatment may incorporate rest and restoration activities to assist you with recovering strength and dependability, or medical procedure to supplant the torn tendon followed by recovery. An appropriate preparing project may assist with decreasing the danger of an ACL injury. Indications. Signs and indications of an ACL injury generally include an uproarious pop or a popping sensation in the knee, serious torment and powerlessness to proceed with action, fast growing, loss of scope of movement, a sensation of precariousness or giving way with weight bearing. When to see a specialist. Look for surefire care if any injury to your knee causes signs or indications of an ACL injury. The knee joint is an unpredictable design of bones, tendons, ligaments and different tissues that cooperate. Get a brief and exact finding to decide the seriousness of the injury and get appropriate treatment. Causes. Tendons are solid groups of tissue that associate one unresolved issue. The ACL, one of two tendons that cross in the knee, associates your thigh bone to your shin bone and balances out your knee joint. ACL wounds regularly occur during sports and wellness exercises that can put weight on the knee. Abruptly easing back down and altering bearing, cutting. Rotating with your foot solidly planted. Landing ungracefully from a leap. Halting out of nowhere. Getting a hard impact to the knee or having a crash, for example, a football tackle. At the point when the tendon is harmed, there is normally a fractional or complete tear of the tissue. A gentle injury may extend the tendon however leave it unblemished. Risk factors. There are various elements that expansion your danger of an ACL injury, including being female, conceivably because of contrasts in life structures, muscle strength and hormonal impacts. Taking part in specific games, like soccer, football, b-ball, tumbling and downhill skiing. Helpless molding. Utilizing broken development designs, for example, moving the knees internal during a squat. Wearing footwear that doesn't fit as expected. Utilizing inadequately kept up with athletic gear, for example, ski ties that aren't changed as expected. Playing on fake turf. Inconveniences. Individuals who experience an ACL injury have a higher danger of creating osteoarthritis in the knee. Joint pain may happen regardless of whether you have a medical procedure to reproduce the tendon. Numerous components probably impact the danger of joint pain, like the seriousness of the first injury, the presence of related wounds in the knee joint or the degree of movement after treatment. Avoidance. Appropriate preparing and exercise can assist with diminishing the danger of ACL injury. A games medication doctor, actual advisor, athletic coach or other expert in sports medication can give evaluation, guidance and criticism that can assist you with lessening hazards. Projects to diminish ACL injury include activities to reinforce the center, including the hips, pelvis and lower midsection, with an objective of preparing competitors to abstain from moving the knee internal during a squat. Activities that reinforce leg muscles, especially hamstring works out, to guarantee a general equilibrium in leg muscle strength. Preparing and exercise underlining legitimate method and knee position when bouncing and arriving from hops. Preparing to further develop procedure when performing turning and cutting developments. Preparing to reinforce muscles of the legs, hips and center, just as preparing to further develop bouncing and landing procedures and to forestall internal development of the knee, may assist with decreasing the higher ACL injury hazard in female competitors. Stuff. Wear footwear and cushioning that is suitable for your game to assist with forestalling injury. In the event that you downhill ski, ensure your ski ties are changed effectively by a prepared proficient so your skis will deliver suitably on the off chance that you fall. Wearing a knee support doesn't seem to forestall ACL injury or decrease the danger of repeating injury after medical procedure.